The reason why I came up with this topic is that as we got going with COVID and the pandemic, I initially was just like everybody else, keeping up with all the statistics and all the symptoms and all of the medical information related directly to COVID. But after a while, after a month or two had passed, I started to think about some of the public health implications of what was happening. Things that I knew in my gut were happening and it to be true, but we didn't have data yet and I didn't have exact numbers. So it motivated me to do some research on some of these other public health impacts of COVID-19 and see where we were at, especially as a country, as a state, to be aware of what is really happening with not just focusing on the hospitalizations and the ventilation rates and the death rates with COVID, but the public health impacts of that. And that's how I started my research. So that gives you a background for this topic. One of the main things that we as clinicians were aware right away was the concerns about the mental health impact. And so I want to talk about that a little bit. So I found some data. This is from, this is a national survey run by Kaiser. And it looked at the percent of adults who say worry or stress related to coronavirus had a negative impact on their mental health, especially when sheltering in place. And so if you can see the numbers, this was taken based on the first 2 weeks of March. So this is even really before it got fully going. 47% of adults said that it either had a minor negative impact or a major negative impact. And this was when the people who were actually being asked to shelter in place. And when they compare that to people who didn't have the shelter in place orders, it was statistically significant. So 37% was for the people not sheltering, but 47% was for the people sheltering. So you can already start to see an impact on negatively on mental health beginning of March. Also statistically significant were not the people who said I have a minor impact, but a major negative impact. 13 versus 21% also proved to be statistically significant. So that's a pretty big number, almost half of Americans. However, when they repeated the same study 2 weeks later, this is what they found. 2 weeks later, same exact poll, the numbers by then, this is data taken early April, most of the country was sheltering in place. 72%, 7 out of 10 Americans said their lives were negatively impacted by being disrupted a lot or to some degree or a lot. That was a 32-point increase in just 2 weeks, which to me was significant because if this is early April, you can think about what the numbers might look like when we're now in, May and June. And the interesting thing was that no group seemed to be immune. There's no demographic that it didn't touch, and across the board, it was very similar. So men versus women, 70 to 74%. Didn't matter if it was Black adults or white adults, 70 versus 78%, higher for white adults. Whether you were parents or non-parents, 73 versus 72%. Across the board, it hit almost every demographic and sector. To me, this is kind of alarming that it's these numbers. And just for fun, I included this data as well. It didn't matter your political party, whether you're a Republican or Democrat. So I thought this was fun that they added this in here. Interestingly, in March, there was a little bit of a difference. If you were Republican, it was only 30% negative. If you're a Democrat, it was close to 50. However, when you look at it at the end of April, even across things like a political party difference, it all evened out in the 70s. So really, in some ways, coronavirus was like the equalizer. Nobody was exempt, and it really equaled and leveled the field in terms of all of these demographics. Now, how does negative mental health, how does that manifest? Well, here's just a bunch of things that I've personally come across and that we know as clinicians. Depression, and on the severe side of the spectrum, suicide. I really tried to find some data on suicide. This was interesting to me, but unfortunately, that kind of data is not going to be available until a year or two after we pass this. However, when we looked at previous epidemics like SARS and previous natural disasters and looking at suicide rate after that, research has said two factors really impact the suicide rate going up. One are natural disasters like earthquakes and things that we couldn't foresee. And the second one was economic hardship. So when we had a big downturn in 2008, there was a rise in suicide for the next year. So when we look at our current unemployment rates with COVID, we don't have the numbers now in terms of the suicide related to COVID. We know that our unemployment rates are off the roof. People are getting laid off, so that economic downfall factor is there. And then we're in a pandemic, which is like a natural disaster. So I am a little anxious to see what these numbers will look like. Also anxiety, and on the severe end of the spectrum, post-traumatic stress disorder. I've seen things that we may not think about as much, like loneliness, even shame. There are people who are feeling stigmatized from getting COVID illness, stigmatized like, I was, out there not being conscientious, even I didn't practice good hygiene, so this is why I got it, all the way to things like confusion, because people are receiving so many mixed messages, confusing messages about what's going on. They're very confused. It's hard for them to make decisions. Guilt, and I've seen this over anything and everything. Guilt over having a job, guilt over getting fired, guilt over working from home versus going out. There's parents who feel like they can't teach their kids well as tutoring. I mean, there's been guilt across the board. Anger and behavioral problems, especially in children. As a pediatrician, I know that our toddlers, and especially our adolescent males, when they get depressed, they don't show it as sadness. It comes out through anger, behavior problems, and outbursts. Overall sense of hopelessness, because there was no end in sight. Things kept on, the stay-at-home orders kept on getting prolonged, and people were sensing hopelessness, and of course fear, whether it was rationally based, like really their chances of getting sick and what it would mean for their family and what it would mean for their work and all those things, all the way to, being like paranoid about certain things, like irrational fears. So these are just like a constellation of things that we have seen in the clinical setting. How do mental symptoms manifest as physical symptoms? So as a medical doctor and not just a mental health professional, sometimes these are the ways children and my patients present to me. Poor appetite, so loss of appetite, or the opposite, which is overeating. They often have a loss of interest or pleasure in doing things. And when I ask this question, this is not just like, it could mean a general blah feeling, but what you really want to know is the things that they enjoyed before, playing basketball or shopping, anything that gave them pleasure, playing video games even. Those things no longer give them a sense of pleasure. And so that is the true test of loss of interest. They have trouble with sleep, trouble falling asleep, trouble staying asleep, or sometimes sleeping way too much. These are all kind of symptoms related to probably more on the depression spectrum. And then there are things that I see a lot like chest pain, discomfort, palpitations, or heart racing. These are more a sign of anxiety and manifesting, or PTSD as like traumatic things like panic attacks and things like that, especially for children. These vague complaints of headaches, stomach aches, nausea. Children really, in terms of a physical manifestation of things going on mentally and emotionally, often present with GI symptoms. Even something that people may not know is that they physically move slower. So we'll ask them, have people noticed that you're like commented that you move very slowly. This is another factor for depression. And things like a lot of muscular pain, neck pain, back pain, because from the tension and the stress, they're always stiff. And so these are some general physical complaints that we see of negative mental health presenting. So I've recently found a study that looked at, well, what people are at particularly high risk for negative psychological impact or psychological harm. And this is from a study of the British Medical Journal. They found that people who obviously already have a pre-existing history of mental disorders like anxiety, depression, older people living alone, or even if they're not alone, if they're in places like facilities because they have been very strictly self-isolating and not having visitors from family and relatives, disabled individuals, especially with learning and communication disabilities. This I didn't really think of until I saw them say this, but we are able to compensate by being on Zoom and still staying in touch this way. But if you don't hear well, if you don't see well, if you can't speak well, this is a challenge, and it isolates them even further. People with recent bereavement, so loss in their family, there are families who have lost multiple family members. I've even heard stories of losing multiple family members on the same day, and it's extremely traumatic. People who've been recently hospitalized or recently had an illness that may or may not be COVID are more at risk. People who have been affected with COVID, like I mentioned, who are stigmatized from the community and are in serious self-isolation for weeks at a time after until they recover and retest negative. Those who are subject to domestic violence. As I've mentioned before, not every home that we have to isolate in is a safe home. People with drug and alcohol addictions or disorders, they're going to rely on those even more. And even if they might have been sober for a while, relapse is a big factor with all of these other stressors. Individuals with extra caretaking responsibilities, because now all of a sudden you're not just responsible for your family, you may be responsible for parents, elderly, and also, honestly, your children who have been out of your home. People who have had to homeschool and things like that report higher stress. Those who have lost their jobs or become unemployed. People who have had to mandatorily quarantine, or people with, like, let's say, immune deficiencies who really have to be strict about not going out at all. And then even our young people, due to closures of their schools, colleges, sports. This has been, I think about this a lot because some of our kids, the way that they cope with some of their borderline depression, anxiety is to do things like be very active and to see their friends and to participate in sports. Kids, especially our seniors who haven't had a proper graduation or been celebrated for their achievements and everything they've worked for so hard. It doesn't seem like a big deal. Those kids are particularly at risk. I've seen high school seniors, grown kids who are ready to go off to college, revert back to like sleeping in their parents' beds because they need that extra comfort and that emotional support. So it really does impact us on all levels. Any questions about this? I'm going to take a break. Any questions or comments so far on what I've talked about? No. Okay, I'm going to keep going. So I wanted to just introduce you guys to 2 quick screening tools we use as clinicians to screen for depression and even loneliness. And I'm putting these on here not because I want you guys to become, you know, like acting like you're a social worker or therapist or anything, but I think it gives you an idea of what clinicians and practitioners look for that label people high risk. So therefore, if you have family members, friends, neighbors, coworkers, you can kind of be aware and kind of realize, hey, maybe this is somebody that I need to check in more often on or be more assistance to. The PHQ-4, the Personal Health Survey, asks 4 very simple questions. Are you feeling nervous, anxious, or on edge? Are you not able to stop worrying or trying to control your worry? Do you have, again, that question I told you before, little interest or pleasure in doing things? Or do you feel down, depressed, or hopeless? You would answer this on a scale of 1 to 3. 1 meaning I hardly ever, 2 meaning sometimes, and 3 meaning often. And 6 to 9 score would mean that you're kind of like moderately at risk. But anything from 9 to 12 would be high risk. And those are the people or relatives or friends that you might even like recommend if you kind of notice these things like, hey, maybe you should talk to someone. Have you talked to your doctor? Those are the people to encourage and kind of check in more often on. There's another scale here for loneliness. It's called the UCLA Loneliness Scale. And again, this is also a very simple one. It asks, how often do you feel that you lack companionship? How often do you feel left out? And how often do you feel isolated from others? Now, I would say during this pandemic, number 3 is almost an often for the reality of many of us. So you're already starting at a number like 2 or 3, not 0 as a baseline. And again, 1 is hardly, 2 is sometimes, 3 is often. And anybody scoring, so the lowest you can have is a 3, the highest is a 9. Anyone scoring above 6, we would consider to be at higher risk. Again, not something that you have to be asking lots of detailed questions, but knowing these are the things we look for, it can help you identify who in your sphere of influence or family or friends struggle with this. I want to shift gears a little bit, and I want to go to domestic violence. This topic is heavy on my heart, so sorry. It's a little bit of a downer, but something we need to all be aware of, because these are not just people who walk in through our health center doors. These are family members, again, neighbors, friends, coworkers, because not every home is a safe home, and for them, it's a prison. New York Times did an article where they surveyed 20 metropolitan cities in the US, and all 20 cities saw an increase in police reports and 911 calls related to domestic violence just in March. And 9 out of those 20 cities saw double-digit percentage jumps in their calls to 911 and police reports compared to either earlier months before or March of 2019. So that's a pretty significant number that it's gone up. And it's not just a phenomenon here, it's a worldwide phenomenon that seems similar across the board. Again, French police reported a nationwide spike of 30% increase calls in domestic violence. And in Spain, 18% had more calls just during the first 2 weeks of their lockdown. So you can imagine that number is going up or higher. It's been higher. Here in the US, this statistic kind of shocked me. 1 in 4 women or 1 in 7 women suffer from domestic violence. 1 in 4, that's a 25%. And it's a 2-digit increase above this baseline. So I wanted to show you where our baseline was, where we're starting to even talk about the increase in domestic violence. So if it's a 25% increase and we add that already to 1 in 4 is 25%, that means during the pandemic, 1 in 2 women could suffer from domestic violence. I said, that's impossible. I literally rejected that figure, but that is an eye-opening figure. Even if it's slightly overinflated, these numbers are not small, and it impacts us as a community, as a health community, as a community in general. Baseline, before COVID, every 9 seconds, a woman is the victim of domestic violence. So again, imagine that going up. In Pennsylvania alone last year, 123 deaths from domestic violence. So if that goes up by 20%, think about the numbers. And if it doesn't seem like a lot, I think in the US, the number is about 2.5–3% fatal cases from domestic violence. If that doesn't seem like a lot, the fatality rate of COVID in the US right now is 5%. So if we compare those two things, this is not a small number. Not only on domestic violence, but then I thought about being a clinician, and our numbers at Jason, as we said, are about 50% less than our regular flow. It made me wonder also how many people delay medical care, getting medical care because of fear of the coronavirus outbreak. And very much in line with what we've seen at our center is the data from, again, this survey from Kaiser. That's at 48%. So 50% of Americans have postponed or skipped medical care during the coronavirus outbreak. That only confirms, and I think makes us feel like it's not just us. Across the board, this number is about right. Well, what does that mean if 50% of us have delayed medical care? Some of those public health impacts, I can tell you, is that what was deemed once non-essential health services are now proving to be quite essential. For example, when things like mammograms and colonoscopies are delayed by 3-4 months, pap smear tests to look for cervical cancer, colonoscopies to look for colon cancer, mammograms to look for breast cancer, we are going to see, and we don't have all the data yet, but we are going to see increase in the rates of early stage breast, colon, and cervical cancer. In fact, my husband did mention, even before he transitioned his work from cancer treatment centers, because he's a radiation oncologist, that the number of referrals for early stage breast cancer was already increasing. They saw a surge in women being referred for early stage breast cancer because we stopped doing mammograms for about 3 months. There are other things that are delayed routine surgeries that got deemed non-essential, but I don't think we're understanding what the increase in the severity and the presentation of disease will be because that has happened. I can tell you, for example, I had a patient, a teenager who had an abscess in her tonsil. Under most cases and any other time besides the crisis, they would have scheduled her to take that tonsil out after the infection was cleared. However, because tonsillectomies were taking tonsils out were deemed non-essential, she had to wait. And in the time that she was waiting, she got infected again on the other side. And she was hospitalized twice during the peak of the COVID crisis, which already puts her at risk. And she was on antibiotics for over 3 or 4 weeks just to tie her off. She was in pain, she was suffering, and this is something that probably could have been avoided and put her at a lot less risk had we not said this was a non-essential surgery. And these are just like my personal stories, so you can imagine how many stories other doctors would have. My brother-in-law is an ophthalmologist in Boston, and he just started to do cataract surgeries again. And just this week, he told me about a case where a woman really couldn't see. An older lady did her cataract surgery, and when he opened up her eye to take out the cataract, he found a tumor in her eye. Now, had she done this surgery 3 months earlier when she was originally scheduled, he might have been able to catch that when it was a lot smaller. And these are the little things that I don't know if we're truly thinking about when we talk about the impacts of COVID. As a pediatrician, one of my pet peeves or heartbreaking things I see all the time are little children, toddlers that have to be put under general anesthesia so that they can get their teeth cavities filled. Because they're so little, they don't stay still. They have to put them under general anesthesia, which is a risky enough thing for a normal, healthy person. And because the dentists have been closed, especially in our urban populations where dental caries and bottle mouth babies are higher, there's going to be a lot of kids that are going to have to undergo general anesthesia just to get something like cavities fixed because their dentist has been closed for the past 3-4 months. And so these are things that may not, the average person may not think about, But as a clinician in primary care, this kind of honestly breaks my heart. And I think one thing that it does, it highlights how important screenings are. Things that we took for granted, right? Like if you, oh, I'll do it next month. You know, how many of us are really on time about getting our mammograms, our colonoscopies, and things done? We say, oh, you know, we don't realize, just this shows us the impacts of what happens when we push screenings off. And that's why screenings are there, to really help our health, you know, to optimize our health and to decrease the burden of disease and the severity of disease on our population and our patients. The other thing that it showed me was that these non-COVID related issues, before we were shutting everything down because we didn't want to overburden the health system all at once. We wanted to decrease the curve. However, now we're going to see an overburdening of our healthcare system for a different reason. It's going to be all of these other non-COVID impacts of this illness, why we're going to be overwhelmed. Because our numbers have been so low, a lot of people have put doctors and nurses and staff on furlough, and we are decreasing how we operate because of financial impact and all these things. I think soon, when things really start to open up, and we're going to need, those people are going to call for those mammograms and start using the healthcare system more. I showed you that 50% of Americans said they delayed their care. The statistic I didn't tell you was 70% of the 50% that delayed their care says, I'm going to seek medical care in the next 2 months. So you can see the amount of overburdening on our healthcare system once that starts to happen. And then if that overlaps with our fall and winter months where we have a second wave of this disease, our healthcare system may be overburdened once again. And I'm not sure who's thinking about these things and planning for these things. As a pediatrician, there's so many other public health impacts, but the one I want to talk to you about is immunization rates. This graph, even though it's kind of small and you can't see it, follow me. This is the number of doses. It counts the number of doses that doctors have ordered through VFC. VFC, or Vaccines for Children, is a state-run but nationwide program. In every state they have it, and they offer free vaccines to children. Probably over 50 to 60% of US children get vaccines through VFC. And they looked at the number of orders for a vaccine. So because doctors aren't giving them, we're not ordering vaccines. Does that make sense? And so in January of this year, they were ordering maybe 500,000 less doses than the previous January. However, look through January, February, March, and follow me down in April. Look at this steep decline in the number of doses ordered. Over 3.5 million doses were not ordered that they normally would have ordered. That's a direct correlate that over 3 million doses of vaccines that should have been given in a span of 3-4 months have not been given. The solid line is our vaccines that don't have anything to do with measles. The dotted line is the measles vaccine itself. Just that one vaccine, 450,000 doses less ordered in the past 4 months. And we're looking at I think, a public health crisis that's beyond COVID. If this bar graph shows you the number of measles kids who got measles vaccine.
You know, Jennifer, that plot that you just talked about.
Yes.
That's almost same as our patient load, patient visit to our center, yeah, which correlates with the COVID.
It all correlates.
Situation.
So I'm so glad it's not just what I think or what I instinctively thought. I'm finding data that backs this up. This bar graph shows the blue, solid blue ones are kids under 24 months. If you weren't aware in pediatrics, pediatricians were told to continue to vaccinate kids under 2. This is with the effort that all pediatricians should be still seeing kids 2 and under and vaccinating them. Look at the decrease in the measles-containing vaccines. And then towards here in April, you started to see an uptick. But the kids over 2 years old is the white bars. Look at how low they are. They're still low, that low compared to before, and we haven't recovered. In fact, if you want to see the number in terms of percentages, I can show you percentages that I found. I found good data for this for our state. So the first week of March, these are just a sampling of a few states across the US. Pennsylvania, we were 20% less in our drop in our immunization rate in March. By 1 month later in April, we were 67% below than the year before. The same month, April 6th, the year before 2019. We recovered a little bit as we got to May, because I think people and primary care pediatricians and physicians started to see this, and they started to say, they made the recommendation that now anyone who is delayed in vaccines, you should see them. So I think people tried to recover, and the numbers were slowly starting to improve. Look at the numbers for New York when they were at their peak, 88%. I mean, children were not getting healthcare at that point and getting vaccinated. These numbers are alarming, and it's across all states. If you think about trying to catch all of these kids up before school start in September, again, I'm wondering as a pediatrician if I'm ready, if we are ready for that. And so I guess all this to say that COVID has had so many public health implications that are beyond just the numbers and the statistics that we follow for COVID illness. And
I have a couple questions on this. One to you, why is the May data, other than Pennsylvania and New York, is so much lower in other states?
I don't know. I don't have data, and I haven't researched those. I'm not sure why. It might be because they might have been, some of these areas might have been under like different stay-at-home, shelter-at-home, and it might have hit them at a different wave, like it shifted later. I'm not sure why. You know, I'm not sure why, but at least some of the bigger cities where we are bigger states were recovering. But I mean, it's like, see this lag here? This was only 1.7%, and then it went up, and they're trying to catch up. I'm not sure.
Okay, now second question is to Kyung-Yi. Since she's working with the kids at the school, is your school preparing for, how are you preparing for the kids given the immunization like this? Is she, I know she's in. 이경희 선생, 회장님.
Yeah. In terms of when they need to get immunization before they come to school or during school year, they needed to probably right now, since they couldn't get it, they have to get it soon. Soon they are able to get it.
So your school's parents gonna be scrambling.
If they don't get it, they have to get certain reason they didn't get it. So parents have to sign that religiously they didn't get it, or you know, right now COVID-19, but they need to get it.
So I can tell you that schools are not changing their deadlines for their. Even from my own kid's school district, I got an email saying, we are not going to give you extra time to get your vaccines and your physicals. They're saying that at the start of school, it's important that they get it. And I'll tell you why. If we are 50, 60% low on things like meningitis, on measles, they're extremely highly infectious. You know, meningococcal disease has a 15% fatality rate, not a 3 to 5% fatality rate like COVID. And you can get it by sitting next to someone in your class because it's also spread through respiratory droplets. So schools are not changing their policies, and as far as I know. And insurance companies are not changing their policies on care gaps and the requirements that they have given COVID. And so this is why I wanted to tell my parents who are on here listening to this. You're ahead of the game, because now that you know this information, you will schedule it before the rush in August and not risk getting delayed or having your kids get delayed in enrollment and starting school, because this is serious. We will lose, if this keeps up, we will lose our herd immunity. And now your kid, you shouldn't be worried about your kid getting COVID. You should be worried about your kid getting meningitis. It's not a light thing. And it's interesting that this doesn't get as much media attention, publicity, press, because right now, rightfully so, where our country is at, there's so many other things taking the forefront of what is happening. And this is why I really wanted to get some solid numbers and data behind my fears, my concerns as a primary care pediatrician, and kind of let people know who will listen. These are things we need to talk about. As a medical center, if we don't ramp up our services and mental health services, we will be behind the ball. And it's a challenge because financially, everybody is hurting right now. But these are the things that I just feel like are priorities. And hopefully it was sobering for you guys and not depressing. And it will help you think about this COVID crisis and in a much bigger scale. When I first heard reports of the country opening, for me personally, I was against it. I said, this is a bad idea. This is going to spread again, blah, blah, blah. But as I started to see all of these impacts related to it, not just the economy, but the public health implications, I kind of changed my mind, and I said, we're in this for the long haul, and we have to get ready and do things safely, but we have to really continue to offer our services and do as much as we can to help these other public health issues. So that is the end of my presentation. Oh, by the way, I decided to list my resources, so you didn't think that I was just pulling these numbers out here. I put my references on here, so when you receive the slides, you yourself can click and read through the articles more in detail, and if you have more questions.
Now you got to start to publish these in the professional publication with all the references.
But I'm hoping maybe even for my medical center, adjacent medical center, it might help us get some grants. And really, we need data and research, and there's not enough on certain other populations. So, I see. We have a bunch of things here.
Yeah, a couple. Good. This is interesting. A couple of things. I think, 경희 회장님, you probably need to let your membership know about this, because most of the children there is relevant, right? So they should start to prepare, have an appointment with the doctors to get the immunization early rather than later.
Yeah, tell the aim for earlier in the summer is better than later in the summer.
Yeah.
Unfortunately, I just got a new patient today where her pediatrician is not offering physical appointments still. I met another patient who they wanted to go to CHOP, certain CHOP, and they said they're not taking new patients till September, because I think they're right. They're already the ones they've established relationship. They're trying to get them caught up. So it's a challenge for parents, some parents, to even find places that are open, that are willing to do things. And so I'm hoping that more and more places will start to open and follow the guidelines from the American Academy of Pediatrics, which says that pediatricians, especially, we must offer catch-up vaccinations and offer physicals to all ages. So I'm hoping that that'll happen. And I think now that we're in the yellow here in Montgomery and a lot of the state is in the green, I do see a change in a shift in patient parents and their fears about coming in. I've definitely been seeing some more numbers of people scheduling. And so hopefully we're headed in the right direction and we will all be caught up by the fall. That's my goal.